Hello everyone, this is Andrew. Welcome to Keen on America.
On July 4th, 2026, America will be 250 years old. An anniversary that will, no doubt, be greeted with a mixture of celebration, contemplation, and resignation. In Keen on America, Andrew talks not just about the American past and present, but also speculates on its future. What, Andrew asks, will be the 21st century fate of this now venerable American republic?
Hello everybody, long-term viewers and listeners to the show know that I'm a big fan of Neil Postman's classic 1984 book, Amusing Ourselves to Death. At the beginning of the book, he suggested we got the future wrong. Rather than imagining 1984 being Orwellian, actually turns out to be a brave new world, a Huxleyan world. And of course, one of the most troubling and memorable features of Huxley's Brave New World, a book published in 1932, was his image of soma, this drug in which everybody in the Brave New World took to cheer themselves up. This was a drug-induced future, and some people believe, indeed, that America is increasingly becoming a soma-like place. My guest today on the show has a new book out. It's called Rethinking Medications. Jerry Avorn teaches at Harvard Medical School, and he's joining us now. Jerry, I'm not sure if you've read Huxley's Brave New World, but do you think Postman was right? Do you think that we are becoming more like a Brave New World than 1984 in terms of our addiction to all these pharmaceuticals?
Right. I did read Brave New World in college, and it had a big effect on me. Actually, I think there's sort of a two-part answer. One is that we've got some really wonderful medications out there that help people stay healthy and stay alive and treat awful diseases and prevent others. And then on the other hand, there are some people that are overly dependent on medications. Often it's not the legal ones that are the most trouble. The ones that are the most trouble are, the opioids and various other recreational substances. But I don't worry too much that we are an over-medicated society. I think our bigger problems are that we don't know enough about the drugs that we actually are taking.
Is there such a thing, Jerry, as big pharma? We've had some doctors on the show who wouldn't appear to be particularly radical, certainly in their politics or in their lifestyle, but they believe, and they've written books about it, that big pharma is essentially not just wrecking American medicine, but American society.
Well, it's kind of like, big anything, big agriculture, big oil, big pharma. These are enormous collections of very wealthy and powerful corporations, and they do some good things and they do some bad things. But I think to pretend that it's not a major force in our economy and in our culture and in our science would be to miss something. Yeah, there is such a thing as big pharma, and we need to get them to keep doing the good stuff and stop doing the bad stuff.
So give us some numbers, Jerry. Rethinking Medications. You know your stuff. You teach at Harvard. You have this new book out, a very interesting book. The average American, how many pills a day do they take? Do you have any idea on that?
Yeah, it's a tremendously variable kind of spectrum. That there are some people, as we all know, who take nothing, and then there's other people who will take 6 to 10 meds a day. And sometimes that's a good thing because those medicines are keeping them alive and healthy. And sometimes it's way too many. So it's not like there's sort of a median that is
but there is an average. I mean, of course, there's always going to be some people who refuse to take any medicine, any pills, even if they're sick, and others who take too many. But what's the average? What's your sense, at least?
My sense is that of people who take meds, probably the average is something like 2 to 4 a day.
And is that too many?
It all depends on the person. Like I said, sometimes it's fantastic that we've got access to those drugs because without them, people would be sick or dead. Sometimes they're junk that people don't need that somebody prescribed for them without thinking enough. And so it's both.
We had a doctor, again, I won't mention his name on the show recently, who told me offline, I was asking him about one kind of medication that I take, and I don't even understand why I take it. And he said, he didn't quite put it in these terms, but he implied that we shouldn't trust our doctors, that we should always be skeptical, particularly when they tell us to take drugs for conditions which don't seem to us, or don't seem to the patient to be particularly pertinent. Is there some truth to that? How should patients negotiate this big pharma world?
You use the key word, Andrew, negotiate. I think it should not be either a matter of unthinkingly doing whatever our doctors tell us to do, or us doctors tell you to do, nor should it be a matter of just rejecting it and being suspicious. I think negotiation, questioning, conversation is really the key. You know, if a doctor prescribes something, I think the patient should say, okay, what's this for? Are there any alternatives? Will I be able to afford it? Rather than assume that the right response is, yes, doctor, whatever you say, or no, I don't believe you. It's something in the middle which needs a conversation.
There's a lot in the middle, Jerry, but you've written this new book, Rethinking Medications, Truth, Power, and the Drugs You Take. Is there a crisis in the medical drug industry, especially from a patient point of view? Why did you write this book?
Well, from a patient point of view, yeah, there's certainly an affordability crisis. If you look at what people spend per person on their prescription drugs, we Americans spend twice what citizens of other wealthy countries like, France, Germany, Japan, Australia, Canada.
Don't mention Denmark, Jerry.
Right. I'm glad I got away with mentioning Canada these days. But, you look at, we're not talking about what people pay in Somalia. We're talking about what people in the industrialized wealthy countries pay. And we pay literally 2 times as much for our drugs per person. And the reason is that we've kind of given free rein to the industry to set prices wherever they want. And as it turns out, that we get a really bad deal as a nation in what we pay. And the companies are making fine profits in all these other countries. The governments there just say, hey, wait a minute, you can't get away with that. And our rule here is you can charge pretty much whatever you want. We even passed a law saying that it's illegal to negotiate price in the Medicare program with drug companies for most drugs. So yeah, in that sense, we are getting a bum deal. The sense in which we're getting a good deal is that we do have a lot of wonderful medications that, like I said, really are doing wonders for the people who need them if they're prescribed well.
So, Jerry, if somebody wanders into their doctor's office and the doctor prescribes a drug, who benefits economically from that? Is it sometimes in the doctor's interest to prescribe drugs? Is that going to win them Super Bowl tickets from some big pharma company? Are they going to pocket some of the profits? Who benefits from this overdrugged, brave new America?
Well, Andrew, often it's everybody but the patient. And what I mean by that is you're right that some doctors actually can make a ton of money on the markup of the drugs that they prescribe. That's particularly true of cancer drugs, but any very expensive drug. Often the doctor's able to buy it wholesale and sell it retail, for example. And sometimes that's a major source of income for the doctor. But there's also a lot of other players involved. We have these middlemen called pharmacy benefit management companies, and they kind of insert themselves into the middle of the process, and they sort of move around who prescribes what, depending upon how big a rebate they get from the manufacturers. So there's that mischief. And clearly, the drug companies are charging well more than it cost them to make, and even well more than they need to pay back the research they put into the drug. So in a sense, everybody is skimming a bunch of dollars off the top, except for the poor patient, who either gets stuck paying the bill or gets stuck with pretty high premiums on their insurance. Or if they're taxpayers, they get stuck, helping to pay the federal government for those bills.
You teach at Harvard Medical School. I assume that somebody at the medical school is teaching these doctors or almost doctors ethics. Why are some doctors, you're suggesting, I know it's not going to be all doctors, but why are some doctors then participating in this immoral circus?
Well, I think a lot of doctors convince themselves that this is part of the business model of being a doctor these days.
Oh
That
my God. So the business model is basically giving their patients pills which they don't really need, but doctors will profit from.
well, they may need them, but I think well, or they may not. But even if they need them, I think what doctors feel is that the markup that they can get by buying the drugs wholesale and selling them retail, either to the insurance company or to the patient, is part of their revenue system. And they often feel that they get undercompensated for taking care of poor patients. Sometimes they do charity work, and they see the markup on the drugs. It's not as if they're giving people things that they utterly don't need, but I think they see that you can do better if you prescribe drugs where there's a big markup, particularly in some of the specialty fields like cancer.
You seem a very reasonable fellow, Jerry, but to me, this is outrageous, isn't it?
Oh, there are so many outrages, Andrew. It's hard to know where
Well,
to
I mean, you've
begin.
written this book on the, I
Yeah.
mean, we could be outraged by all sorts of things today.
No, I
but,
mean in the medication
but
system.
in terms of rethinking medication, this is one of the more outrageous elements in this rotten economy, isn't it?
Right. No, I wasn't referring to the world as a whole where there is rotten things, but I think in the whole sort of ecosystem of medications, there's a lot of things to get upset about in terms of, what, for example, why should a company charge $160,000 a year for a cancer drug that was completely discovered on the basis of grants from the federal government and taxpayer dollars? But one of the examples in the book is such a drug. I think that upsets me more. The whole notion that the public is really underwriting a very expensive and very effective research system. And then we passed a law in 1980 that says that a university can then sell the rights to that drug, even though it was publicly funded. And then the university can get a lot of money and the manufacturer can get a lot of money and the patient gets stuck holding the bag. That upsets me even more in the hierarchy of things to be concerned about.
There is, of course, a certain RFK Jr. who has been articulating quite a radical agenda for reforming American health system. He's very controversial. Don't need me to tell you this. Are some of his arguments, Jerry, right about fundamentally reshaping American medicine? What's his take, for example, on rethinking medications?
Well, I worry that he's got a couple of talking points that, who could disagree with? He's against chronic illness. Well, who isn't
Who
against
isn't?
chronic? Exactly. Or other things that, he wants the food supply to be pure. Well, who doesn't want the food supply to be pure? And I'm scared that those sort of mom and apple pie talking points that obviously, people will be drawn to are going to help him get through a really zany agenda, which is much more specific and much more dangerous, like all of his talk about vaccines causing autism. Sometimes he says they cause cancer. Sometimes he says they don't work. And I think the specifics of what RFK Jr. is saying are very scary and potentially damaging and much more worrisome than I can take comfort in, he's against chronic illness, because everyone's against chronic illness.
We're all against chronic illness. That goes without saying. Jerry, this kind of book will make some people very suspicious, not just of big pharma, but perhaps of their own doctor. I'm not reaching for my pills. I think when you read your book and when you listen to what you're saying, we might throw away our pills. But is there a danger of these endless books and critique from insiders like yourself of the American medical system that will only empower RFK Jr. and his movement of conspiracy theorists and people who have peculiar ideas about vaccines? Are you concerned that the medical establishment itself needs to kind of group together to not undermine the system without at the same time, of course, telling lies about how it works? I know this is a very tricky path to negotiate.
No, I completely agree, and I wouldn't want anyone to get the impression that this is one of those don't take your pills, don't trust your doctor kinds of books, because there's a lot in there about how great our medications are. And we've got, for heart disease, for cancer, for a whole host of illnesses, we've got fantastic medications. And I'm a big booster of rational, science-based, evidence-based medication use. And nobody should get the sense that I'm one of those throw away all your pills and don't trust your doctor. What I do want is to have us have a kind of more thoughtful, evidence-based approach to approving drugs, to paying for drugs. And there's a whole appendix in the book about ways patients can talk to their doctors about their drugs. Not, I'm not going to take this, you're trying to kill me, but rather, what's it for? What will it interact with? Is it affordable? How will it work? And I think, any doctor that doesn't have time for that, you should probably find a better doctor. But part of the prescribing process needs to be one of conversation and education. But by no means is this an anti-medicine book. I love medicines. I prescribe them my whole life. I take a bunch myself. And I think they're great. We just need to do it more thoughtfully, both in the review process, in the doctor's office, talking to the patient, and also in the way we pay for them.
Yeah, we've done lots of shows on reforming the medical system from a patient point of view. And often our writers, our observers, professionals like yourself say, well, the patient needs to be more responsible, more intelligent, talk to their doctor, do some research. And of course, the type of people, Jerry, who do that are people like yourself, your students at Harvard Medical School, perhaps myself. Is there a danger that the American medical system is going to become one where the high end of highly motivated, highly literate people will negotiate it very intelligently? The middle will essentially drop out and everyone else will become victims of an increasingly corrupt system.
Well, that's a worry, I think, not just about medications, Andrew, but for everything in life, about, everything that we do. We have this risk that the well-off are going to end up unfairly better and the less well-off are going to get shafted. Luckily, there is the opportunity whenever a patient is in a room with a doctor or a nurse practitioner who's prescribing something, any patient, regardless of their income or level of education, can say to the doctor, what's this for and can I afford it? And that's not a conversation you need a college degree to have. And it's a conversation that I think it ought to be part of a doctor's responsibility to have. But it's also part of the patient's job to not just either blindly take whatever somebody writes down on a prescription, nor blindly reject everything. It doesn't need to be a postgraduate conversation, but just a what's it for and why are you giving it to me? And if the doctor says, I don't have time for that, find another doctor.
Jerry, what's your take on these new, and correct me if I'm vulgarizing their term, diet pills, which are, and actually speaking of Denmark, it seems to have sort of dominate now the Danish economy. I think there's one company in Denmark that makes up about 50% of the entire economy. Ozempic and all the others, are they very much in keeping with the thesis that you make in Rethinking Medication?
I really like those drugs a lot. I just wish they weren't so damn expensive, because if they didn't have a list price of $1,000 a month, I think we wouldn't think twice about wanting more people to be on them, not just for diabetes, but also for weight loss. And it turns out they prevent heart disease, they prevent kidney disease. They really are, I think they will go down in history as one of the most remarkable scientific discoveries of this decade, or maybe even this century medically. And frankly, if they didn't cost so much, we would not even be worrying about them. But they do cost $1,000 a month, which is terrible. And we are at risk of really, going broke in the healthcare drug system because of the fact that they are so expensive. But in terms of safety, in terms of effectiveness, they really work very, very well. And I wish everybody who needed them could get them. But unfortunately, there is that price, which is a real problem.
Yeah, and you obviously know much more about these pills than I do, but aren't there two questions on it? Firstly, there are some side effects. And when I was researching this show, some people apparently get swollen feet, and some people have fevers after taking these pills. But secondly, they are by definition addictive, because once you go on them, you're stuck. Because if you stop taking these pills, then you'll put weight back on. So aren't they problematic in that sense, with or without their cost?
Sure, we would much rather have a drug that you could take, for 6 months and then you'd be fine. That is not the case here. And we also do need to do a much better job of having Americans, eat better and exercise more, and all the things that, everybody's grandmother's been telling them for generations. And I think if that were the case, and if we didn't just assume, oh, here's a pill, I don't have to worry about what I eat, I don't have to worry about exercise, I'll just take the pill. That's not a good way to use these pills. And I'm hoping that we might be able to get to a point where people can use these drugs as part of a total management plan of learning what to eat, about getting up and around more. And that might enable people to shed the pounds and to then keep them off without the pills. And that's an area of a lot of inquiry right now. But you're right. If you just take it and say, oh, great, I'm not going to change anything in my life, as soon as you stop taking the pills, the pounds are going to come back.
Yeah, and you mentioned earlier, everyone's grandmother gives the advice of eating less and exercising more. People have known that for generations now, but it seems as if fewer and fewer people do it. So these pills will only make people less dependent on exercise, and might actually result in more ill health. I mean, we can't blame medications entirely for this, but America is increasingly an unhealthy society, especially when compared to other industrial societies, isn't it?
Right. That is certainly true. And I remember we had a similar conversation back when the statins came in for cholesterol. And they also, sort of like these new GLP-1 drugs, work really well, have got remarkably few side effects considering all the good they do. But there was a concern that, if I can prescribe somebody a statin like Lipitor for their cholesterol, they just, won't want, they'll have cheeseburgers 3 times a day and never leave the couch and watch TV all the time. And some people said, well, that's a problem. Maybe we shouldn't use these drugs because, for exactly the reasons you're mentioning, they might sort of encourage slovenly behavior. And yet I think what we learned over the years is that the way to deal with slovenly behavior is not to deny people medications. I think it's to give them medications and to, at the same time, and this comes back to the conversation with the doctor that I try to help people think about in the book, about what to say to your doctor about how do I use this. It's incumbent on the doctor not to just write a quick prescription and send the patient out, but to say this is part of a whole package of stuff you're going to do. You're going to take the pill, you're going to watch what you eat, you're going to get around more exercise-wise. And if people really did that instead of just writing a script and sending the patient home, I think we would not have this problem of the weight comes back the minute you stop.
In technology, Jerry, when something comes out at first, the iPhone, for example, it was incredibly expensive, or some of these 3D technologies. And then after a while, when it acquires mass adoption, prices come down. Is that true also with drugs? You've talked about these GLP diet drugs. They are currently pretty expensive. I think about $1,000 a month.
Right.
Should or will the prices come down as these pharmaceutical companies achieve what, at least in Silicon Valley, we call scale? Or is the problem, because of the sort of Byzantine privatized nature of the American medical system, that prices are not really affected by the market?
Yeah, I think you put your finger on it in that last phrase, Andrew, that we have, and one of the things that frankly upsets me, more than most things around medications, is that we have allowed our patent laws, for example, to become so abused that, okay, fine, if a company discovers a drug and it's great, they deserve to be able to have a government-granted monopoly called a patent on it for a period of years. But what my colleagues and I have discovered, and I write about a bit in Rethinking Medications, is that we've now allowed the patent system to build up what they call a thicket of patents around the drug. So you've got the patent on the original product, and when that expires, there's about 10 or 20 or 30 additional patents that the companies take out. And it becomes so bizarre, like inhalers for any of the listeners or viewers who might have, chronic lung disease or asthma. They will know how these inhalers, which have very old drugs in them, have been so expensive for so long. And that's because we allow the drug companies to not just patent the drug, but to patent the little counter on the inhaler, to patent the strap that the lid for the inhaler goes on, and to do all these additional patents that really are not fair, but enable them to build this patent thicket around it so that essentially the patents never expire. Our colleagues in Europe are much more savvy about that, and they say, you get a patent for the drug, that's great. When the patent expires, it goes generic. We've allowed the brand name manufacturers to kind of do an end run around that. And that's one of the reasons our medicines are so expensive and don't do what you were just describing.
So it's more than just going into the doctor's office. There are broader political challenges, patent reform, blame the lawyers. Where will that come from? Given the power of big pharma lobbying, will it come from politicians, for example, perhaps increasingly running around issues like this? It's not the sexiest of issues, but on the other hand, it touches on most people. Do you think politicians need to be more outspoken in addressing some of these issues?
Yes, and if I may disagree, I think it is a sexy issue. I mean, in the sense that most Americans are affected by unaffordable drug prices, and I think if the politicians could get their wits about them and say they're going to do something about it, that would be a real winning issue for them at the ballot box. But unfortunately, the largest lobbying group in Washington is the pharmaceutical lobby. And they've got politicians on both sides of the aisle kind of beholden to them because they are enormously big donors to both parties. We did make some headway in the last administration where there actually some laws got passed about trying to restrain drug prices. There was a very dynamic new head of the patent office who was in charge of things. There was a very dynamic head of the Federal Trade Commission. And after the November elections, both of them left their positions. And it looks like Congress has lost its appetite for really getting on top of this, even though if they were thinking clearly about it, they would know this is a winning issue for them.
Why is it a winning issue, though? I mean, you think it's sexy. Insurance is in the same sort of ballpark, and it affects people, but politicians don't run on it. I mean, are there politicians? Elizabeth Warren comes to mind, Bernie Sanders, AOC. Are there perhaps more progressive politicians on the left who address it? Does Trump say anything about it?
Well, Trump just recently issued an executive order that he said was going to rein in drug prices. And my colleagues and I have looked at it, and we're not impressed that it's going to really make a big dent. The same week, he announced big tariffs on pharmaceuticals. And what that's really going to do is, since most of our drugs are made overseas, what we do know is going to happen is that those big tariffs on pharmaceuticals are going to raise the sticker price of the drug, not just down the road, but when the patient goes to the drugstore, this year. And so he's kind of heading in the opposite direction in that regard, I think.
So it's a kind of government tax on drugs. So when someone usually paid $100 for their monthly drugs, pills, it will end up at 120 when they show up at the pharmacy, and they won't even understand why it's gone up.
You got it. Or even more than that. And his rationale is, well, we want the companies to make their drugs in America, which is nice, but you don't just kind of pick up your factory and move it to America. It's going to take many, many years before they can create a manufacturing presence in America.
Where Jerry, are most of these drugs are manufactured? Southeast Asia?
India and China. That is the source of most of our generic drugs. And anybody who's sort of been worrying about this field for a long time would know that if you slap big tariffs on China and India, where that's going to definitely hit is the price of the drugs that we import from them. It is true we stopped making our own drugs years ago, and that's not ideal, but we're not going to be able to fix that in the next year or two or three by just increasing the taxes. And the problem is that it's something which is going to hit Americans this year, and they're not going to have time to wait for someone to build a drug factory somewhere in this country.
we know, of course, about the pill mills in West Virginia and the opioid crisis. But is there a large black market in the United States for drugs?
Do you mean of the opioid variety?
Well, of any. I mean, if, for example, these new diet pills. If pirates were able to, and I was before preparing for this conversation, I know there have been a number of warnings about online quote unquote sales on these generic drugs. Should people be really careful?
Yeah, I think it's always a good idea if you're getting a prescription medicine to get it through normal channels and not to see something on the internet that you can get it from some black ops operation and you don't know where it came from and who made it. Now, I'm not talking about generics or biosimilars that are FDA approved. They're great, but if there's something that is coming to you through unusual channels and you're putting it into your body and it's a strong chemical, I would not advise doing that. But what we need to do, just to follow up, Andrew, I'm sorry, just to follow up, what we need to do is to make the regular drugs that we have that are FDA approved, where the manufacturing plants are certified and inspected, we got to make them affordable rather than having people going onto the internet and finding something from God knows where.
I don't want to turn this into another conversation about tariffs, but some people's critique of Trump is that he gets it the wrong way around, that America's value in the world is its innovation, its research at places like Harvard Medical School, and that leave the manufacture of these drugs to India or China, but make sure that America focuses on high value. Do you agree with that?
Boy, do I. And I'm so glad you brought that up because it is really relevant to what we're talking about here. We are speaking in a week after we've been, we at Harvard Medical School and the rest of the university have been told that the government is going to basically shut off billions of dollars, most of which is for medical research. I think a lot of listeners and viewers may not realize that when they talk about, Trump is going to put a hold on $9 billion to Harvard or $400 million to Columbia or other places. Most of that is National Institutes of Health research money that goes to the medical school. And what's particularly ironic is that he's claiming that this is because he doesn't approve of what happened on the undergrad campus around demonstrations about Palestine. And first of all, it's a totally different campus, both at Harvard and in Columbia, that are miles apart. And really, who's getting beat up for this ostensible protest on his part about anti-Semitism, which, as a Jewish person, I can say I really am offended that he is using anti-Semitism as an excuse to beat up on entire universities. But where that problem is going to crop up is research on medical issues and discovery of new drugs. And I have colleagues at Harvard whose research has now been unexpectedly, utterly interrupted. And they're studying, non-political things like tuberculosis and HIV and, conditions, cancer. And it's just crazy that this somehow has been interrupted in this really bullying kind of way. And we're going to pay the price for that before long, because this research was life-saving and it's ground to a halt.
You mentioned earlier, Jerry, that at some point there may be pills that will ensure that we won't get cancer. What is the new frontier when it comes to medication? Could you imagine in 25 years a pill that everyone will take that will pretty much guarantee that they won't get cancer?
No, but there is good news in that for particular cancers, and we're increasingly understanding that there are really very different diseases, one from the other in cancer, that we have gotten way better than like when I was a medical student, where we really didn't have a whole lot of tools that worked for treating cancer. We've now got a lot of wonderful tools for treating previously untreatable cancers. So it's not going to be one pill that'll either prevent it or cure it, but we are going to see, and we have been seeing for the last number of years, specific tools, whether it's immunotherapy or better kinds of chemotherapy or all sorts of advances that are there now and are in use right now in order to treat cancers once they develop. Preventing it, the biggest preventable cause of cancer in the United States is smoking. And if we could just get people to stop smoke, that would be a wonder drug, equivalent that is fantastic. But what's scary is, these things don't come out of nowhere. They come from research usually funded by the federal government. And I never thought I'd hear myself saying this, that research has now been shut off in a lot of universities for no clear reason.
The New York sociologist Jonathan Haidt has a book out, The Age of Anxiety, which has done very well.
Right.
We've had a number of conversations about the anxious nature, particularly of younger generation, and the more and more of them are themselves medicating on one kind of therapeutic drug or another. How does that fit into your arguments in rethinking medications on two fronts? Firstly, the generational quality. Are younger people more or less likely to be addicted, so to speak, to medication? And secondly, are you particularly concerned about drugs which deal with mental health, given the supposed epidemic of mental illness in post-COVID America?
Yes, I am, and I'm glad you raised that. By contrast to all the great discoveries we've made in cancer, we've really not moved very far in many decades in drugs for mental health. We've mostly got the same old drugs that we've had. What has changed, though, as you say, is our reliance, and I don't mean doctors, I mean parents, kids, the culture, as well as doctors, on medical solutions to human problems. And I think that's the issue that Haidt raises in his book about, if we are basically becoming a very atomized culture with, kids spending more time on their devices than they are with their friends or with their families, then they are going to become progressively more isolated and anxious and depressed. And we know that. And we know that, ironically, some of the social media companies cultivate that because they can, do better financially if somebody is really kind of addicted to their platform. Speaking of addictions, so I worry that the drugs that we have, people are turning to much more as a solution to the fact that their adolescent is depressed or nervous or unable to concentrate or whatever, when perhaps in an earlier time we might have said, hey, let's figure out a way that we can either modify the kid's environment or make sure that the school system is able to deal with it. Now there's too much of a tendency to say, well, what can we prescribe for it? And that's just not going to get at the problem.
Why, Jerry, has there been so little progress? Is it because scientifically it's a particularly tricky field, there's less investment? One would have thought, given that Big Pharma wants to make money and the enormous demand for these new medicines, that this would have been an area of enormous progress.
Yeah, one would have hoped. And I think it comes down to the fact that of all the organs in our body, the brain is by far the most complicated. And while a lot of interesting neuroscience research is going on, we still don't have any more of a clue than when I was in medical school about what causes schizophrenia. On the other end of the age spectrum, we've got Alzheimer's disease. And I write in the book about some really crappy drugs for Alzheimer's that really don't work.
Yeah, we did a show. I'm sure you're familiar with the book. I can't remember the name of the author, about researchers who essentially fictionalized their research on Alzheimer's, and they were found out.
Right. And these are really, really pretty inadequate drugs. And yet the FDA green lighted them in ways that I find unconscionable for that first one that then got pulled from the market. And so, between schizophrenia, anxiety, depression, Alzheimer's, the brain is the toughest nut to crack, so to speak, in terms of we know how heart disease works. We're learning a lot about cancer. We've not really made much headway, probably just because it's the most complicated organ we have. And it's that doesn't stop people from marketing and selling and manufacturing and prescribing drugs for your brain. And some of them work real well, not the ones for Alzheimer's, but some of the ones for, if you really need it, some of the other drugs for the brain. But they do tend to get overused because it's an easier solution than, in the case of depression, anxiety, adolescence, dealing with the underlying problem.
Finally, Jerry, speaking of the brain, we are increasingly being encouraged to outsource our brain to AI. One of your colleagues, I'm sure you know him, Robert Pearl, is a frequent guest on the show, former CEO of Kaiser Permanente. He spends time both on the East and the West Coast. He teaches at Stanford University. He's cautiously optimistic about AI solving a lot of the problems rather than addressing the bigger issue of AI. How might it enable us to rethink medications? If we go to the AI doctor, are we more or less likely to be able to rethink medications? And might AI indeed enable revolutionary research when it comes to the brain itself?
Okay, key question for 2025. And I guess it's a two-part answer. One is on the biological research side, it's amazing, and it's already proven itself in terms of understanding how proteins fold on themselves, which used to take years and years and years. And there are some great AI programs that have figured that out in a matter of just weeks. And that's at the very basic side going to be revolutionary.
Yeah, DeepMind made major breakthroughs on that a month or two ago.
Exactly. And that's going to be great. But that's at the very, very basic preclinical level. The other bit of good news is that at some point in years to come, I think AI is going to be helpful at the clinical level in terms of thinking about what medications a person ought to be on. But right now, we're in the earlier stages of it. And I give an example in the book in which somebody, actually Google put up when it was first launching its AI overviews, where if you said, what's a good way to maintain calcium? And the answer it gave you was eat rocks. And the reason was because the AI program scraped a lot of stuff from the internet, and some of it was from The Onion, the satirical magazine, which had a funny article about how if you ate enough rocks, your calcium would be good.
At least it's not telling us to eat onions like the French.
That's right. But it couldn't tell the difference. It couldn't tell that actually was a goofy article. So it's going to have to get much smarter about, what's real, what's not. Was this a good study? Was this a bad study? Were the control groups correct? What were these statistics? And it'll get there eventually, but it's not there now. And I don't think any listeners or viewers ought to go to Dr. Google, as my friends call it, to find out about what meds they should be on. And we suggest some better alternatives in the book.
A better alternative might be going to Dr. Jerry Avorn, who is the author of Rethinking Medication, Truth, Power, and the Drugs You Take. Very wise advice from Jerry on how much medication we should take and reforming the system. Jerry, congratulations on the new book. And I think your remarks, particularly on the Trump cuts, are particularly concerning. Best of luck. We'll have to get you back on the show as the implications of some of these cuts over the next few months work themselves out. Thank you so much.
I'll be happy to do that. Thank you, Andrew.